Welcome, everybody, to the second episode of the Recreation Rooster podcast. This is Dan Chievo, and this is Myisha Jones. Say hello.
Welcome, everybody. So happy to be here today. Thank you for joining us.
Yes, for sure. We have, she's from LA and she's got a West Coast background on. And as you see, I have the city of New York in my background because that's the area I'm from. And by the way, as you can see, I'm wearing my Snazzy Recreation Rooster T-shirt, and please feel free to. You guys can have one too. Please support the show. It's $23, including shipping and handling. So we have another full episode right now. Um, so I believe. Did you say you wanted to do the quote of the day to start with that, or did you want me to do that, Maisha?
Go ahead, Dan.
Okay. So I'm going to pick this one. Therapeutic recreation is the prescription for happiness. Instead of having a pill that doctors often prescribe, they could prescribe our services the same way they do for PT and OT and speech and language therapy. And in licensed states, maybe that happens. But not enough people know about what recreational therapy is. So as it's getting more and more known, it's going to become more of a service that will be reimbursable and prescribed by a doctor. Anything to add?
Absolutely. Yes,
Yeah,
can you repeat that quote of the day?
I will. Yeah, and that's important because it's a good one in that sense. Therapeutic recreation is the prescription for happiness.
I love that. I love that. And when we think about what happiness looks like and how we can quantify those qualitative type of, I would say, emotional experiences is something that's a superpower that we have as recreation therapists. I will often say, taking a more non-invasive approach to health, wellness, and happiness is just one of the great things that we can do as practitioners, that we can spread the word to our colleagues that we work with on a day to day basis and also to our clients and consumers. So when I think of happiness, I think of a not just a feeling of joy and of contentment, but also a action of being able to explore your ambitions, to learn and expand and to interconnect with other folks and other people in your life and to be able to improve your, I would say, not just your functionality, but also your mindset on a day to day basis. I feel like happiness is an action word. What do you think, Dan?
Absolutely. Well, it's something that stems from within. And we are one of the unique disciplines that can really trigger that internal motivation for people. So that's a big part of what we do, and that's part of the reason why what makes us unique.
Yeah, and just thinking about how do we quantify happiness in our day-to-day interactions with our clients and with our consumers when we have our objectives in our recreation therapy leisure goals that we may have for our clients. Many times, we do a SMART objective, meaning something that is observable, measurable. Oftentimes, I will, especially with my clients who may suffer from, who may be challenged with aphasia or unable to speak, I look for those visual cues in their body language, such as eye tracking, such as lip smacking, such as smiling, such as vocalizations and willingness to engage to show that they appear to exhibit, I would say, the visual manifestations of happiness. And oftentimes, what we do is we track this through number of occurrences or through duration over a certain amount of trials. And oftentimes, we as RTs, we're asked to quantify the progress or lack of progress that we may experience with our clients when it comes to our intervention. So I definitely encourage each and every RT to find ways to quantify those qualitative benefits that we provide to our clients on a day-to-day basis. So I love that quote. That was a great quote.
Yeah, quantifying abstract concepts like happiness, that's just kind of what we do. It's kind of funny when you think about it because it's not something that everybody would think of that you could quantify, but that's essentially what we do. Everybody wants numbers and to see progress in terms of numbers. So we have the arduous task of quantifying fuzzy concepts such as happiness, quality of life, and other measures that lead towards functional capacity.
Yes, yes. Oftentimes, what I tend to do is I will use a post and a pre and a post Likert scale. Other times, I might go to my trusty red book, which is, as we say, the Recreation Therapy Bible. And from my studies in my master's program in hospitality and tourism, oftentimes I will go into hospitality and tourism surveys and research to quantify happiness and customer satisfaction when it comes to social engagement, right? We know it's definitely a science to this, and I encourage each and every RT to continue to be, that therapeutic, I would say, catalyst to happiness for your clients because we don't give happiness, we allow the client and the consumer to pull happiness out of themselves through experiences with one another. It's a very cathartic um, effect that is beneficial to everyone. And it's such an energetic charge. Also, as well, when you see someone in true joy and bliss when they're interacting with others, that's one of the perks to the profession that I think is a wonderful thing.
Yeah, we definitely see it. And we have the challenge. Yeah, I'm not sure how many of the other disciplines actually quantify some of those fuzzy concepts like enhancements in interpersonal skills and happiness and joy and love and other areas that are unique to humanity
Yes,
that we quantify, which and which is part of the reason that with a push, it needs to be more recognized. So, and then we could establish standards and get insurance companies and others on board with those standards.
absolutely. Oftentimes I will read different publications like magazines, lifestyle magazines, and they will have articles on what is the top 10 happiest cities in the United States? Or what is the top 10 happiest countries in the United States? And what they will do, they will formulate 5 to 6 benchmarks of criteria that is used in these surveys when they go out and do these random sample surveys to these large groups of people in the various states or in the various cities in various countries, and then they will of course crunch that information and come up with the raw data to show what cities are the most happiest, and people take that information and they use that information to decide where they want to have their forever home, where they want to raise their children, where they want to work. Oftentimes even with work culture, different types of surveys and research is done to show which companies have the most happy employees as well. So I really do feel like this is an area that recreation therapists can utilize their skill sets to help these type of research companies make these determinations on what cities, what companies, what countries really have the happiest people.
Right. And of course, I mean, we're unique in terms of we're able to set up a workplace that fosters some of those concepts like happiness. and
Absolutely.
enhances workplace culture. So that's something that is transferable to other areas of business. Just like
Absolutely, and very lucrative.
yeah, without a doubt. I mean, employee retention and that type of a thing. That aspect of welfare capitalism has become a big aspect in human resource circles as well. And we also, because of our experience quantifying different fuzzy concepts that are tough to measure, like interpersonal skills and happiness and joy and love, we are able to measure concepts that people like different other therapists really want to know, like
Yeah,
cognitive improvements, focus, and other areas. And we have unique qualifications to do that because we've kind of learned how to put quantitative data into what areas that have traditionally been studied qualitatively. So,
absolutely. I agree. I do know that it's a considerable amount of recreation therapists that may have their bachelor's or master's, and we do have more and more recreation therapists starting to pursue their master's and their doctoral degrees. And I think it's a great collaboration between practicing recreation therapists in the community and also doctoral and master's level RT students to start to delve more into this type of research so that we can show not just recreation therapists, but also other disciplines and other businesses and other different realms of industry that this type of information is super valuable when it comes to making those strategic decisions about what type of campaigns, what type of social change campaigns and business moves should be made. Um, as we all know, a happy employee has better work productivity, which in hand um, trickles on down to better quality of services for their clients, which trickle down to better outcomes for their clients. So, this information on having a therapeutic approach to joy and to happiness is essential. It's essential.
yeah, in fact, I mean, especially with the movement now, with how mental health affects people's productivity and depression can lead to burnout and other things, and we could be the real antidote to that. So.
I really do believe that we are the antidote to that. And it's so interesting because it's like sometimes the solution is right in front of you. So I challenge every RT to elevate your voice when it comes to these issues and these concerns and show the asset and the value you are and that you bring to the table when it comes to these type of things. For your 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 day to day at your at your employer or even for any private work that you're doing outside, just make sure that you continue to elevate, amplify, and magnify all the great services that you provide. So we're going to move forward to our next segment, which is called Looking Forward. So this segment here is the Recreation Rooster podcast take on the advancement of the profession. Where do we see the profession going? How do we forecast that? And how do we put actionable plans in place to make it happen? So, with that being said, I know a big hot topic with all recreation therapists is licensure. Okay. I currently, right now, many of us either have national certification, regional, state, as well, and a host of other supplemental certifications and other specializations. However, each and every one of us desire the title and the discipline and professional protections of licensure in various states. And we're hoping that many of these opportunities to get licensure will also correlate to us being able to have opportunities to practice under that license in adjacent states as well. I do know that right now, California, which is the state that I reside in, does not have licensure. And we have found ourselves kind of in between a rock and a hard place when it comes to protection of our scope of practice because of the lack of licensure in the state. Um, we want to advocate and hopefully get licensure 2025, 2026 through progressive and robust lobbying and advocacy measures. And this starts at your agency, it starts through our collective organizations that we're affiliated with as recreation therapists. It simply even starts with our political and civic engagement, attending um, local, state, and national town hall meetings and different fundraisers for different politicians who can champion our, I will say, our fight for licensure here and in every state in the United States. What's your thoughts on that, Dan?
Yeah, well, licensure is definitely a big issue, a hot topic. It's also one that we have to be involved in other areas, like we was kind of talking about before, like politics. We have a lot of transferable skills that could be used in other areas, like, we were talking about business, running companies, human resources, employee retention, hotel and hospitality. We have skills that can be transferred to other areas and outside of our small field, other people, the healthcare setting, other people could see what we do and the impacts we have across different sectors. So
Right.
we need even more people in healthcare administration, the ones who are the decision makers for health and human services, to get the funding. So
I
that's
agree.
why our scope, our field has been very small and it's kind of limited itself. Uh, I encourage you all to use your transferable skills, make yourself as visible as possible. And that's part of the reason we're doing, trying to set an example by doing a podcast like this, because we
Absolutely.
need our voices to be heard.
Yes, yes, indeed. And I would say, me being a recreation therapist for over 20 years, one of my main reasons for really, really wanting licensure is to protect the profession. We have so many different disciplines and groups of people that have rebranded parts of our scope of practice and capitalized on it. And we need licensure to protect us. We are a small but mighty group of recreation therapists, nationwide and globally. But let's be honest here, there's a wave of health and wellness industry that's all over the globe. People are bouncing back from COVID-19 and many, many other pandemics and other environmental, I would say, challenges that have impacted health and wellness globally. So now we have an influx of new people coming into the space and attempting to mimic some of the services that we provide legitimately as therapists. And
Right. What people
I feel as though licensure will aid us in ensuring that we can delineate ourselves from those particular persons. Go ahead, Dan.
Right. Well, what people might not necessarily understand if you haven't followed this necessarily is that what happens is, I mean, we do have a international certification body, which is NCTRC, which certifies us as certified therapeutic recreation specialists. That's well and good, but to save money is sometimes what companies I feel like have done is hiring managers might look for outside of the field, saying that person sounds close enough to a recreational therapist. Let's hire that person. And that's really kind of concerning because they don't have the background that we do with regards to the participants in the field. So that's why, just like PT, OT, speech and language therapy, and social work, we need licensure. I mean, their system has been state by state to do licensure. I'm not sure that's the most effective way. I think national is probably best, but uh,
Mm,
either way, we need a standard that uh, protects the profession, like Myisha's talking about.
absolutely. So yeah, I mean, some people in the profession, meaning recreation therapy, they believe that licensure will also not just protect the profession, but to give a baseline of quality of services, which I feel as though our certifying agency does that portion. I really believe that licensure will more so protect the therapists, and also, of course, protect the community at large as well from folks who are not, I would say, skilled or competent enough, or may not even be in our degree to go
Right.
into spaces, pretending to be a recreation therapist. So that's definitely something looking forward in the profession that I'm very strongly, I have a strong, I would say, view is on target. So I am definitely willing and able to do any and all to ensure that, licensure is something that's available for every recreation therapist. And I thought that was a great suggestion that you had, Dan, of there being a national license. Um,
Yeah,
I don't know if it would ever be possible, but I'm even comfortable with a regional one, as
yeah,
well.
uh,
That would
yeah,
be great.
yeah.
I have looked into licensure in Utah, which getting licensure in Utah is very it's very easy to get licensure in Utah. I did research it as well. And then, of course, being able to use that licensure in Utah to practice in certain states that they have agreement with, I thought was a great way to expand your reach as a recreation therapist and having licensure under your belt to do so. Oftentimes, we find ourselves in situations, especially even with um, medical or insurance billing, where licensure is one of the barriers to RTs being able to go into those spaces and being able to do direct billing. So I'm really interested in seeing licensure in our future. In our future. So next up,
No doubt about it. I mean, of course, yeah, there's no doubt about it. Licensure is, well, it can be one of the key things. That's very interesting what you were saying about Utah. I didn't realize that necessarily. I know the status in New Jersey is that they actually passed a bill for licensure. We're just kind of waiting for it to be, yes, I know that's a big thing. We're just kind of waiting for it to be set up. So, no, that was passed in 2021. It's now 2024. It was January 2021 that it was passed, I believe. So we need to get a licensing board up there, credentialing board, and reach out to all the CTRSs who practice in the state to become licensed. I believe that's what I was told is the next step. So if you're in New Jersey, watch out for that. That's my state, New Jersey, right now.
another beautiful thing about licensure that I did observe just kind of doing private practice work is that when you have everyone under a licensure board, another thing that happens is the public has access to everyone who's licensed. So whether or not, you're an RT that opens a business or doesn't open a business, any person, any consumer, any private citizen can go onto the licensure board and pull up your profile and they can reach out to you for business. I find that to be amazing. That we can do that much like the same if you were building a home and and you were interested in a contractor and you wanted to see if they were legitimate. Being able to go onto the licensure or permitting board for your local municipality and being able to pull up their information, their certification or license number, their permit number, and pull up history on them, it really does create a sense of trust and proper vetting for our clients, consumers, and business to business opportunities that we have as RTs. Because currently, right now, we're able to go onto our national and state certification boards websites and pull up our certification number and make sure that we are currently certified, but it gives us no other information. And depending on which website that you go on, you may get even less information than that. And I do feel as though, consumers, especially consumers of today, modern consumers, they're more discernible. They want more information. They want reviews. They want access to history. They want more public access. And oftentimes, unfortunately, going on to some of our certification and even some of our professional association websites, unless you're a member, you don't get the information. So it's like we're hidden in plain sight. So that's something that we do need to change across the board is that when we get these national and state certifications, we join professional associations. The public in mass should be able to research us and get access to us and find out at least the basics about us. That way, when they want our services, they can know that they did their vetting before they, go into a service agreement with us. What's your thoughts on that, Dan?
Absolutely. It could actually possibly move it where you could Google recreational therapists and there'll be a list of them and reviews and everything like that, almost like with Yelp. If you go to a
Yeah,
restaurant or you're looking for another kind of a therapist.
right.
So,
That's my thoughts on that. I mean, I know that for therapists that are registered with that have national provider identifier numbers,
NPI numbers, yeah.
um, oftentimes when you do pull up a person's name and you put in their NPI, usually a profile comes up. And oftentimes I've done it in the past and I've always seen very well put together profiles for doctors and nurses and nurse practitioners and physical assistants where you can get information. We should have something like that in place for recreation therapists too, who are also a part of that also do MPI, have MPI numbers and do billing. There should be a place where, consumers can find out more information about us. We don't want to be hidden in plain sight. We want to be out there and about. So I feel as though licensure will help to catapult us into the spotlight and also offer us those added protections that we need um, as a small but mighty group of therapists. Yes.
Right. That's a great thing. Looking forward.
Mm-hmm.
Absolutely.
So that just puts us right into our next segment on advocacy. And when we think of advocacy at Recreation Rooster, we think of amplifying our voices, magnifying our voices. And the thing I would say regarding advocacy, and this is at the grassroots level. So we just went from national, global, state regarding licensure that we can get as a collective to professional efficacy that the individual recreation therapist can do every day that they're practicing. And so, my take on advocacy that I really wanted to highlight today on this episode is on a day to day basis, the recreation therapist, especially when they get an opportunity to speak in a interdisciplinary or a clinical consultation meet is that they come with two things. One, that they come with um, the plan of care, and two, that they come with the progress in tangible, quantifiable data. And then, of course, utilizing those two things to infer recommendations and to give insights and input to other disciplines as we come together to come up with the I would say the general plan of care, right? The overall plan of care. Time and time again, me as a manager and even as, a direct care therapist have went into settings where many RTs go into treatment plan meetings and clinical consults unprepared. They go in unprepared, meaning they don't have the information that's needed to infer and relay and recommend a course of action. Okay. And then other times, what has happened is because other disciplines are accustomed to us not speaking, they don't even ask us anything, or they just skip past us, or they just float over us, or just, glaze us over. And I would say when you're in a situation like that, it's important for you to speak up and let them know that you have something to say. And I know that this is something that oftentimes can be very intimidating. However, this day to day intentionality of showing the value and the asset that we are to the plan of care is essential in ensuring that recreation therapy as a profession will continue to thrive, will continue to be viable for our consumer base, and that we will not get pushed out or diluted or replaced by persons that are not recreation therapists. So that is my advocacy thoughts for today. What's your thoughts on that, Dan?
Sure. Yeah. Well, that's a big thing, like we were talking about, quantifying the data on stuff that's difficult to measure and creating, having strategies available, such as pre and post tests for your participants, and establishing other forms of data to help people meet their objectives. And so, yeah, we have to make sure that we're doing that, of course. And yeah, we have to be talking about that at care plan meetings, but also at our other allied health events and other areas where we have the opportunity to speak. So,
Yes. And this is something and this is something that I would say it's not a skill that's learned overnight. So even though we're bringing this up, don't feel discouraged. Just understand that this is like every other skill that we teach our clients or our consumers. Practice makes perfect. As you practice it and practice it more, you will become stronger and more confident in it. You will find your voice and you will see a ripple effect that will happen amongst the other disciplines and the other RTs that see all the great work that you're doing. We don't want to just be amazing when we're facilitating groups or doing interventions. We want to be amazing when someone opens their electronic health record, when someone asks us to come to the, I would say, a program meeting or an in service, when we go to our weekly treatment team meetings. We want to be amazing and show the value that we add to plans of care and to, I would say, a client or a consumer's health outcomes. We want to show it in every setting that we can show it in. So I've spoken to many RTs who say, I'm comfortable in front of the clients, but I am not comfortable in front of my colleagues. So like I was just mentioning, I do believe that public speaking is a huge part of it and preparation. I also believe that many schools that offer programs in recreation therapy, that they should have a strong focus every semester on public speaking and on communication,
Yeah,
so that these recreation therapists will be more confident when it comes to sharing all the great work that we do.
yeah. Well, and public speaking, and also the trick of placing writing objectives that are, smart, measurable, specific, time bound, etc. So basically, if the overarching goal, say, I want to live in the community again, the objective could be within a specified time frame, well, within the next 3 months, I will be able to identify three engage in three leisure activities that help me increase my ultimate goal, which would be living in the community again. So that's basically an example, a very small example of how you would quantify, say, a segment of a objective.
Mm-hmm.
So that way we can make it measurable, the overarching goals that people have. And of course, humanizing the goals is
Yes.
that with the whole thing with people with disabilities, that they're not necessarily so much different than us. They all want the same things in many ways. They want strong
Yes.
relationships. They want a nice place to live. They want a decent job. They want health care. They want uh, the best for themselves and their families. So
That's so
that
true.
and talking to our participants about that you're not that much different than anybody else, despite your disability.
Absolutely. And I thought it was so interesting how you mentioned that one leisure goal or leisure objective, because it spoke to it immediately made me think about discharge planning and the role that recreation therapists play in discharge planning, and how it is so underutilized in so many different agencies, and how
Yeah,
oftentimes with recreation therapy objectives, it's either going to be, skill acquisition or symptom management, right? Or
yeah,
even, goal setting or leisure exploration. Um, and many, many other types of approaches that we can take to our leisure objectives. But I really do enjoy how you just showed a very simple way of us tracking, leisure experiences for our clients, but also how it can be also ramped up to have milestones and be even more complex as well. I think that as we begin to master that skill of writing very good leisure objectives, it only strengthens the profession. And it strengthens the advocacy that we can have because we have the numbers to back the great work that we do when it comes to health outcomes for our clients.
yeah. That's what it's all about. It really is. It's all about those numbers, that's those data. That's what the insurance companies, the pharmaceutical industry, the billers, the payers, they want to see. They want to see the actual data that we're getting better, that the people we're participating with are getting that better. And we really ought to have discharge planning in mind from day one,
Yes,
oftentimes in many populations. Like, yeah, what is their life going to look like afterwards? And putting together, that's where leisure education really helps. I mean, I work with people where we put together a whole packet for people leaving, based on their interests. If you like
love
reading,
that.
here's yeah, a list of the libraries, phone numbers, email addresses. Same thing with the local parks and recreation and other things where they could tap into their interests and leisure. For a lot of the people who are rehabbing and recovering, that's a big motivating factor for them. Once they A big motivating factor and a big factor that helps them function again, gives them motivation to function again once they leave the facility.
Yes, indeed. And we find that if we do a proper discharge plan with community linkages and warm handoffs, right, preferably to other RTs in the community, we can reduce recidivism. We can reduce that revolving door. We can
Right,
save
saves money.
agencies money. We can
Yeah,
save agencies money. And oftentimes I find it so interesting how I will work with a psychologist or a social worker that might be the lead of our treatment team, and they recommend, or psychiatrists, and they recommend recreation therapy while the patient or client or consumer is in the inpatient setting. But once the client goes to the outpatient setting, they don't recommend it anymore. And I oftentimes, it's the weirdest phenomenon, because I often say, well, if they benefited from the psychosocial and the psychoeducational programming that my team provided, then why wouldn't you link them to a resource in the community that has recreation therapists as well? And 9 times out of 10, the answer that I hear is, I didn't know you guys were out there. I didn't know you guys were out there. I didn't know that there was a place that did that, you know. And then oftentimes I say, well, let's look it up and see if there is some places in the area. And then other times I ask, well, if there isn't any in the area, if there's no RTs that are doing outpatient treatment, for clients or consumers, what is the alternate? And oftentimes you hear that there's no alternate. There's no alternate service in place that can provide that for our clients. So I just really encourage, even with the discharge planning, that you consider RT, that you don't just refer them out to Parks and Rec, but that they need more specialized services. And hopefully, as more and more RTs continue to expand outside of the confines of a medical and recovery model, and start servicing, mass markets on the outpatient in the community, then we'll have more and more options for our clients, and they will improve their health and wellness. So I think that's a great thing. So that's my take on advocacy. So next
right.
up,
Well, I mean, of course, you know this actually better than anybody because you have a private practice, Myisha. That's well better than mine. I mean, mine's in the infancy
oh,
stages in many ways.
yours is
Because
great too.
I appreciate it. It's getting there, and I've been getting a lot of referrals from Ignite One, so I gotta thank them as well, and Faja Robert as well. That's been very wonderful to have that. But as far as with regards to community-based TR, it takes a lot of finding discharge planners and other uh, people who can refer to recreational therapy in the community. So that's kind of what we have to be doing to start a private practice, ideally. And
Absolutely.
right. And of course the billing sources for that, like, the DDD service in New Jersey and other, potential billers, because unfortunately, yes, it's private pay unless you could find potential um third party payers.
Yeah. You'll be surprised how many of my clientele is private pay. And I believe it goes to several different reasons. Number one, when you look at the process of discharge planning and referrals, you don't see recreation therapy on the paperwork. It's not there. You may have an option of other where you can write it in or type it in, but even then is at the bottom of the page. And for a social worker, a psychologist, a psychiatrist that has a high caseload, I promise you they're not looking at the bottom of that page. They're checking off what they think is the essentials, which is probably the top 5 disciplines, and then they're pushing that through the process. So we really do have to rethink the way that we as recreation therapists appear on in these processes, and the access to us when it comes to these processes, when these case managers do these discharge plans as well. I would say just be a strong advocate. If you can be given notice prior to one of your clients or consumers discharging or moving on to a lower level of care, that you take that extra initiative to advocate for recreation therapy to be included in their plan of care when they leave out. And by you getting that signature from that case manager that is allowed to do referrals, it will greatly enhance the possibility of a recreation therapist being sourced and being paid to do the work, be it through third party billing or through a super bill. At least there's going to be an effort for that step down facility to source out that recreation therapist. And I have myself over the years been giving received phone calls from different businesses that did have recreation therapy placed on their clients' discharge from one place, be it a state hospital, clinic. I mean, not clinic, but group home, family home to another facility. They had it on there, and for that reason, I was Googled and I was called, and I was able to pair a recreation therapist with that client, private charge. So definitely, discharge plans are the way to go. Because what is it for us to be licensed, right, as RTs, and not have a feeder or a source of receiving clients? We want both. We want to be sustained with access to a large pool of clients who require our services, but also the protections that come with licensure.
Right, and what you do is very interesting because I mean, how did you find some of those? I guess through conferences and other places, you found some referral sources, and of course, you also created some contracts. I know with those places. So,
So your question was, how did I find the sources?
right, yeah, that's part of it.
Well, one of the ways that I did, and it was a lot of different ways, and I would say you would be surprised how many different
Places are
industries.
looking for, yeah. I mean, some of these people, I'm sure, are looking for places to refer people. Of course.
Right, right. So what I did was, depending on what population you wanted to serve, as we all know, all intermediate care facilities and SNFs, which are specialized nursing facilities, require permitting and licensure. So some of my first contracts, I literally went on to the licensing page, which is where all of them are listed, right? And these are confirmed and vetted and verified businesses. And I utilize that source to do warm calling and to set up proposal meetings and to do mailers and flyers and began to go into the spaces where they congregated so that I could understand what the need was and then see if I can provide solutions to those needs, cost saving or even revenue generating. And then what began to happen was I began as an RT to delineate my services from the other services they already had in place and show that they had a value statement to them, that they were better, they were more customized, they were more consistent deliverables, better health outcomes, and that they, of course, were ethical, legit, and utilizing best practices. And that is always a great way to start. Because one thing about these licensing and these permitting state and county and city organizations is they vet those businesses. Because you never want to find yourself in a situation where you are running down rabbit holes of illegitimate businesses. You only want to source and work for legitimate businesses. One, for your safety. Two, to ensure that it's upstanding, the clients are being treated well, that if you go into these spaces that you're safe, that there is a certain standard of care that is being maintained as well. And also to ensure that when you invoice after you do your work, after you do your treatment, with the clients that you're paid, as
Yeah,
well. So, one place I would say to source is always to go into the intermediate care facility and skilled nursing facility licensing websites where they have all of them listed. They have the owner, they have the house manager, they have everybody listed, and you contact that owner. Don't contact that house manager. You contact the owner and set up a meeting with the owner. That's what you do. Starting there, and you'll do great. You'll do great if you have, um, I would say, great customer service, impeccable. You're currently competent. You use best practices. You're ethical. You're courteous. You have great professionalism. You're timely. You're prompt. When you show up, you're clean, ironed, and smile on your face, and you are resourceful and knowledgeable about your profession. You'll do well because there's a lot of clients out there that need us. So, um, I know that we talked a lot about advocacy. Advocacy is a huge topic for us in recreation therapy because we need to do more and more of that, as Dan mentioned. So this will always be a segment that we will speak on and on and on about.
absolutely,
Mm-hmm.
without a doubt. Yeah, and if it gets sustainable enough, like you've been able to hire people under you to do services, so that's really great.
Yeah, it is. It is. And on a day-to-day basis, just being, an entrepreneur and taking those chances to get out there in uncharted water to expand the reach of our profession, it's exciting, it's exhilarating, and it's been quite lucrative, I must admit. So just very happy about that. And I want to encourage each and every RT to step out there and jump into that uncharted water of entrepreneurship and see where it takes you. All you can do is try. All you can do is try. And also too, we have to encourage one another and empower one another. I really do envision a time when we'll have a consortium of recreation therapy entrepreneurs where we can just, in addition to our, of course, our collective organizations that we have in place, but having a consortium where we can empower, build each other up, lift each other up, and utilize our input, impact, and our influence um, would be a beautiful thing, in my opinion.
There's no doubt about that. Private practice is definitely one of the big ways I see us moving forward, and that's definitely a way I feel like we can advocate for the profession, and getting third party reimbursement does help. I mean, of course, having that's where licensure would come in handy, but there's other ways to get there's other ways and services. There are other third party payers sometimes that you
Mm-hmm.
make do with, from Department of Developmental Disabilities to Medicare, and in some circumstances they'll cover your services, but
That's right. Yeah, and a series of waiver programs and stuff, as you mentioned before,
waiver
that
programs.
is being, utilized in certain states as well. But we always have to be mindful that the goal is to, of course, tap governmental programs, but also to tap the mass market so that we can show that we are competitive, that we do offer a product on the open market that is valued, that people will pay for as well. So tapping both is essential because anyone can say, oh, it's a waiver program. What you expect? No, no, no. We're going to tap both. We have those that are clients and consumers and businesses that take a more proactive stance on wellness. And we want to be an added option for them when it comes to developing experiential therapies for their well-being and for the well-being of their staff and their family, and pushing campaigns forward that their business or that their corporation might be interested in promoting in mass market as well. So definitely having a recreation therapist on staff is an asset to any business, in my opinion.
No question. Absolutely.
Hmm.
So
Well, I
yeah,
guess we belabored that, didn't we? We're gonna talk
I
about the
have.
next segment. I'm sorry, guys.
You're
So
absolutely
we're gonna
right.
talk about the nuts and bolts of TR. Take it away, Dan.
Right. Well, I mean, and this was something that I kind of learned about in graduate school, and it's very essential as far as building community. We have our first place is our home where we live. Our second place is our work. And our third place are the communal spaces that we gather. And those are essential for building community. That's where you see people and talk to people you might not otherwise talk to. There's usually almost like in Cheers, it's usually a place where everybody knows your name, kind of a thing.
Yes, I love that.
Yeah, it's that kind of those kind of spaces, and how I just wanted to highlight how they're very vital to democracy. You might get into conversations and meet groups of people and meet get together for advocating that you might not otherwise meet if we didn't have those spaces. So those cafes, bars, restaurants, and parks, and other places that are communal meeting spaces, hair salons, barbershops, are very central to democracy and building a community and a vibrant democracy, enhancing citizenship, etc. So,
I love that. And just speaking on the nuts and bolts of TR, as Dan did mention, a lot of times we as recreation therapists, we transform spaces, especially in inpatient settings. And we, for that hour, for those 3 hours, we transform that dining hall into a cafe. We transform that treatment room, you know, into a spa. We transform spaces. It might be an outdoor patio from a mental health unit. We transform that into, a social environment where we may have a barbecue. Or I remember when I worked for the Department of Developmental Services, we had a trailer that I literally transformed into a computer cafe for our youth, so that they can utilize it in the evenings after school was over. And this was an inpatient forensic setting for adolescents. So oftentimes, whether or not we utilize spaces within buildings that we work in, or we go out into the community and we procure experiences in different venues and settings, we definitely foster a sense of belonging and opportunities for people to get to know each other's names, to get to know what shared interests they have and what shared interests they do not have as well, offering a sense of belonging and having that cheers effect. So definitely, we do have a campaign going on right now nationwide about, I would say, equity, diversity, inclusion, and they've even added belonging, feeling like you belong. And I often say that these it's essential that recreation therapists join in on these type of campaigns when it comes to creating experiences of belonging, of social interaction with one another. So I love the fact that you did highlight um, the belonging aspect, the cheers effect of TR, because that's definitely part of the nuts and bolts of what we do is accessibility, inclusion, belonging, sharing. Definitely, we really do.
sure, yeah. I mean, of course, and there's other ways to, like we were talking about, with that's what we do kind of strategically. I mean, I run programs where my goal is mimics the care plan goals. The person will be able to hold a conversation for 5 minutes with at least one other person, and to develop their interpersonal skills. So,
Hmm.
and that's what we do. Those we try to foster and then encourage, facilitate, prompt, cajole, for those very small, measurable objectives
Yes.
to help people improve their interpersonal skills and other outcomes that we are really targeting.
Yes, indeed, indeed. And next up, we're going to talk about behind the numbers. Okay. So, just thinking on behind the numbers, I wanted to speak to the amount of uncertified recreation therapists that we have practicing here in the United States and around the globe. And when I mention uncertified, I mean those that are not NCTRS certified, also not state certified. Um, we find that we have about 40,000 RTs um, around the globe, and we have about 19,000 that are NCTRC certified and smaller subsets that are not. So that leaves us with a large amount of RTs that are out here practicing without certification. We need to find out how we can tap that large subset, and we need to also ensure that that this subset finds the value in getting certified. Oftentimes, we do talk about our salary and our wage and how it's very low. And many RTs who may have initially been certified when they were fresh out of school, they felt like they didn't need it anymore. They felt like the cost of being certified wasn't worth the benefit. So we definitely need to discuss this more and explore how we can create incentive for this other subset of uncertified RTs to become certified and eventually to become licensed. What's your thoughts on it, Dan?
No question. When you think about it, I guess you said there are 40,000 recreational therapists, 19,000 licensed, which means that there's 21,000 that are not licensed. That's a problem, which means that there's more unlicensed providers than licensed providers. So we need a path to licensure for those people to kind of grandfather them in and at least if they want to meet those standards, good. If not, they we need to I guess see the people that don't, kind of get out I'm trying to think of a nicer way to say it, but alleviate the people who don't uh want to be, who aren't, don't meet that standard. So yeah,
Understood.
absolutely. Yeah,
I guess there's really no nice way of saying it, right?
right.
But let's look at the bigger picture of it all. Yes, if a person doesn't meet the standards, then no, they cannot practice. But
Right.
let's look at the bigger picture of the fact that the reason why there are so many unlicensed, I mean not unlicensed, I'm sorry, uncredentialed RTs is because many agencies do not require it. They do not require it. They do not have a system in place to evaluate competencies on a regular basis either. So that right there alone is one reason why many don't see the need. However, we need to definitely extend an olive branch and find a, like you mentioned, a path to one, incentivize getting certified or credentialed, be it licensure um, or certification, whichever is available, but also um, fostering and nurturing and mentoring and embracing, the collective as a whole as well. So I find that, behind the numbers, this is something that we should explore more and more about the subset of recreation therapists that are not credentialed. Yeah, so that's my take on that. We'll talk more on that on another episode. And next up, we will have a segment on social spears.
Yes. With regards to social spheres, one thing that I would like to talk about is that for a lot of people with disabilities, the biggest barrier, and sometimes people in rural areas and other spaces that for whatever reason don't drive is there's not a lot of public transportation, particularly in this country. I know that so far, what's happened in a way that has gotten better the last few years is Uber, Lyft, and rideshare services to help
Yes.
with getting to a lot of those public spaces. I know I've been in even rural areas where occasionally I've needed an Uber and I was able to get one, an Uber, a Lyft, or other place. So I know people who have been able to do that. So that's kind of expanding the gap, filling in the gap, especially since taxi services and other car services are very expensive, and there's not really a lot of them out in rural areas anyway. So that's one of the big things that has, I guess, increased overcome the barriers for transportation to access to leisure services. So hopefully it will continue to do so, and there might be other services, of course, that I'm not even aware of, but
Yeah.
that's one of the big things that's come in the past 10, 15, 20 years. I got to tip my hat to that. It's not a perfect service. Those aren't perfect services, I'm sure, but it really has, I feel like, kind of narrowed the gap in terms of accessibility for people with disabilities, in terms of getting from place to place, because
Very
I know it's
true.
one of the big issues.
I did want to also mention too, just on the whole thing of, I would say eco travel and travel in general. I find that a different travel and destination companies, booking companies, they now offer full packages. It used to be a time where you could just get airfare and lodging. But now you can literally get airfare, lodging, and your car is included in the price. And then they also have a few other businesses now like Assessa Go, and even different, I would say, subcategories in what is the name of the company of different travel sites where you can get access to accessible hotel rooms, cars that have accessibility. So I do find that more and more different hospitality and tourism and destination travel businesses are having more inclusiveness. And now I believe the big buzz was about the airlines now offering opportunities for clients who are wheelchair bound to have more room in their seat area. That's huge. And we see this happening more and more where companies are understanding that they have to take a more inclusive stance and offer more options. And because every traveler is not the traditional, um, two parent, two kid, 2.5 kid household anymore. The traveler is very diverse and very discernible, and we all want to have great experiences. So I think that's a great social spheres topic that you decided
Sure.
to
And
utilize
even
today.
Airbnbs and other places might have better deals than hotels. So
Hmm.
with there's more options I know now than ever before.
Yes, indeed. A couple other things that are I find to be more recreation therapist led when it comes to social spheres is, our seasonal programming where we may have adaptive sports at ski lodges, or we may have adaptive sports at rivers and beaches, surf camps and all types of water skiing. We have so many different options that are available, and all the various camps, specialized camps for certain chronic ailments that gives children and families opportunity to bond and connect with others. I find that recreation therapists do a lot of that. I would love for the day to come when these camps and these recreation therapists designed and facilitated social events, I mean, in camps and travel excursions will be added to sites like Travelocity and like, um, cheaptickets.com and different things. They'll be added to packages for families that are looking for these type of staff assisted experiences. I think it'll be a beautiful thing. And companies like Accessigo, I feel like they cater to that as well. We definitely need to have more exposure when it comes to the RTs that are doing these type of really really great adventure ropes courses, these, really great, 3 day, 5 day, 7 day excursions to state parks where, accessibility and adaptive devices and accommodations are put into place. Um, we were even speaking about scuba diving, adaptive scuba diving as
Yeah,
well. So, just having, great opportunities to go to places like Bora Bora, Hawaii, and Fiji, and work with recreation therapists that specialize in these type of experiences. I think it would be a great thing to be able to book from, some of these travel sites just with a click of a button. And then now you have a booking as a RT, and you have, a group of, 5 to 7 or maybe 10 to 12 persons that can go out and have a great experience and come back and talk about it on their YouTubes and give you Google reviews and all of that great stuff.
wonderful. Yeah, absolutely. Which reminds me, right here in the New York City area, they have one in Rockland County, New York, Pearl River, Long Island. I know they have maybe a couple others in different places, maybe Florida, or I know there's one in Israel. But Sunrise Day Camps is a wonderful for any of you who know, or if any of you have kids with cancer or their siblings, they offer free camp for kids with cancer and their siblings. So,
Mm-hmm.
which is just a wonderful program for kids with cancer and their siblings. I mean, because that's something that really affects the whole family. So
Yes,
I
it does.
volunteered there a few times. They have volunteer days, and it's one of the some of the best days of the summer. So because it really makes the kids happy. So then they have all kinds of theme programs with carnivals and space camp days and other things that really engage the kids and that they look forward to, camp competitions. And so definitely wanted to put that out there for anybody who's going through that hard time of having a kid, knowing of a kid with cancer and their siblings. Sunrise Day Camps is the name of it. So
Thank you for mentioning that. And we'll go on to our next topic because we're winding down. We realize that we've been quite wordy today, but we have a lot to share, and we really do enjoy sharing. So our next topic is fast facts in therapeutic recreation. Take it away, Dan.
fast facts. Um, I thought you were gonna do this.
Okay, I'll do it. So we were going to talk about marketing.
Oh, right, that's it. That's right. Right, yeah, that's right. I was going to talk about that. Sorry, thank you for jogging my memory.
No
Uh,
problem.
as far as marketing, we do a lot of that in with marketing our programs. Of course, I've looked into different areas in marketing and management and realized I have a lot of the skills because I've done a lot of marketing of my programs myself. You're always highlighting what you're doing and putting it in the papers and making it visible and generating press releases, doing newsletters and other avenues that are around marketing. So that's one of the fast facts that, that's another transferable skill that we have that we could definitely utilize all over. So don't be afraid
Absolutely.
to utilize and highlight those skills.
And I oftentimes feel as though RTs are not acknowledged for the large amount of our 40-hour work week that we devote just to marketing, just to finding out what our consumer, our client, or is interested in doing individually and as a collective, right? and then curating those experiences, and then building up momentum for them to be excited about participating in it. Because as we all know, majority of recreation therapy programming is not by force. It's not forced. Okay. So encouraging, that client that's been depressed, laying in bed all day, to get up out of that bed and wash up and get ready to engage. It takes a lot of skill. And then now, even more so, if your client has access to cell phones and social media, the added challenge of pulling them away from that phone to engage with you, if it is a in-person program, or even if you're doing a telehealth program where it's virtual, having them click on your link to engage with you versus clicking something else, right? So marketing now has many, many layers to it, right? As for us as RTs. So we definitely have to be creative, stimulating, and then we also have to still do the fundamentals of going and speaking to people and clients in person to drum up that I would say that interest to engage. So marketing is one of our superpowers, I would say, regarding TR. And it's definitely, a fast fact. Many RTs do marketing in our services, unlike many of our other counterparts, OT and PT, where they get their referral might be for 6 to 12 weeks, and the person comes to the gym, interacts with them on a one-to-one for 15-30 minutes, maybe even 45 minutes at times. And it's just part of the plan of care. But as an RT, we have an added layer of doing that print media and that digital marketing, creating digital products to get out to our clients and to our targeted demographics. And that's something that we do in the inpatient, outpatient setting, and also in private practice. It is a huge part of sourcing for RTs. And I think it's great, So I am learning about media kits and all type of exciting things, and um, looking at the way that marketing is done on social media, even is another layer that we are learning about. And I find that many new RTs are very well versed in that area of marketing. So I always glean from therapists that I work with regarding how to enhance and improve our marketing when it comes to having clients come out and engage in recreation therapy.
And that could be a full-time job too, on top of being a recreational therapist. It's almost like we could do a marketing director so we got to be very careful not to burn out. So that's
Absolutely. I
and
totally
leverage
agree
all
with
those
you.
skills. Yeah, so we at least get compensated for it. So,
And our last segment for today is our Recreation Rooster stamp of approval. And today I wanted to highlight the Shepherd Center. The Shepherd Center is a neuro rehabilitation center in the heart of Atlanta, Georgia. I really wanted to highlight this center for two reasons. One, because they do staff recreational therapists. I have met a few that have worked there in the past, and also a few that are currently working there now. And they do groundbreaking programming. And I think that it is a great center that embraces integrated approach to care. They have a few patient programs in particular. They have the spinal cord injury rehab, they have the brain injury rehab, the multiple sclerosis clinics, the spine and chronic pain clinics, the Share Military Initiative Clinic, the Stroke Rehabilitation Clinic, outpatient program clinics, and they also have research department as well. I have a friend who suffers from MS, and she has been a long-term client consumer for Shepherd Center for the last, I would say, 10 years. And she expressed to me the great experiences that she's had at the center with the recreation therapy department and how it has further enhanced her health outcomes. So I wanted to give a Recreation Rooster stamp of approval for Shepherd Center out of Atlanta, Georgia.
Very good.
And I want to thank each and every one of you for joining us today for our second episode of Recreation Rooster Podcast. Take it away, Dan.
Yes, and once again, we thank you very much. As I mentioned before, t-shirts, $23. You can get a hold of us. You can get a hold of me directly, Daniel at recreationrooster.org. That's Daniel at recreationrooster.org. Come get us get a t-shirt. It looks really cool and it'll wake you up in the morning. And of course, 845-987-0104 is my mobile phone number, 845-987-0104. And we will also have our consulting services open for anybody who wants to have us consult. So, and yeah, here's Myisha to give her information as well.
I want to thank each and every one of you for participating with us today. We really do want to improve and enhance and increase our viewership. So please like, share, and invite a friend as well. You can always reach out to us at www.recreationrooster.org. Our shirts will be available on website soon as well. And we're really, really excited about the upcoming new look to our podcast, which is coming the last Monday of the month of January, moving forward. But we will continue to expand and break ground. If you would like to reach out to me directly, you can reach out to me at Myisha at recreationrooster.org. And my name is spelled Myisha. You can also reach out to New Horizons Concierge Firm. The number is 213-524-6925. And we will see you next time. Follow us again and see us next Monday at 4 p.m. Pacific Standard Time, 7 p.m. Eastern Standard Time. And have a great day. Bye bye.